Hi, I'm Kimberly. I'm a nurse practitioner here at King's Daughters Medical Center and Ashley's Preceptor.
Hey class, so for the assignment this week we have to talk about some things that we have seen and experienced through the clinical rotation. And I have really enjoyed this clinical rotation. Of course, it's the first one to go around, but during this rotation I've got to really see how patients with substance use disorders have dual diagnosis of a lot of common mental health disorders like PTSD, anxiety, depression, even some like bipolar a couple of times. So throughout this 7 weeks, I've had the ability to learn a lot during this clinical rotation. I've improved on my interviewing techniques and my assessment skills and psych management, especially with addiction medicine. I've really enjoyed this rotation. I felt like I'm finally able to kind of put all the pieces together and apply the learned material from the program into practical applications. So I've learned some evidence-based practice guidelines for substance use treatment and common mental health disorders. And I'm gaining a greater insight on discharge planning and for inpatient patients. And I'm learning more ways to be collaborative with ancillary departments for patient care. So one thing I'd like to work on, and that we have worked on throughout this 7 weeks, is building on that medication skills. So I really feel like that's an area that I'm incredibly weak in. I have a really hard time with the recall of the medicines. So that's one area I really would like to work on and get better with, and continue working on the practicing diagnosing patients using the DSM. So we did that a lot too during this clinical rotation. So
Ashley's improved a lot. She's done really well with the diagnosing and learning how the DSM-5 works, learning how to look at your patient and dig through the DSM-5 and find what matches their criteria for that diagnosis. She's doing really well with that. I've seen a great improvement over the last several weeks that she's been with me. Learning all the patient skills and being able to go in there and feel comfortable with the patient and sit down and build a good rapport during the interview process. She's done very well with that. And she's absolutely correct. In this addiction medicine, psychiatry world, we learned that there are very common dual diagnosis. So they are commonly found to have a substance use disorder with that mental health disorder, and it's common that that's how they're coping with their mental health is using that substance to kind of mask their feelings. And I've kind of burned in her head that when we're treating addiction medicine, that we always want to treat that mental health underlying disorder too, because what's going to happen when they're not using that substance is they're going to start feeling all those feelings, and that's normally when they're going to have their relapse. So we always want to treat that and give them that dopamine back that they were getting from the substance. So she's done really well though. I've seen a great improvement. I can't wait to see what she's going to do in her practice. She'll do great.
Thanks. So probably one of the patients that kind of sticks out the most in my mind, we've had several really good examples this 7 weeks, but one, and it was incredibly sad. It was a 39-year-old with end-stage liver disease, and just heartbreaking to see someone that young go through something like this.
He was told he needed a liver transplant while we were there. We had just walked in the room and he was just told that. So dealing with that, Ashley got to see firsthand how to communicate with a patient who just received terrible news, was told to go home on hospice and wait his 6 months to get his transplant. So dealing with that, learning how to communicate with that patient therapeutically, it was a good experience, I feel like, for Ashley. She was able to navigate that in the room with me, because it was not something we were expecting when we walked in.
Yeah, absolutely.
Yeah.
Absolutely.
Very sad situation, but a great learning learning experience for her.
Yes. So, all right. Well, thank y'all. I wish everyone the best of luck in their rest of their program and, of course, within your future careers. Thanks.